Hello, my name is Liliana Chavdarova and I'm the Program and Policy Coordinator of PACT. This video is a pre-recording of the presentation for the PACT Partners Assembly meeting, which will be held on Wednesday, 9th of June at 10 to 11:30 CET. At times of pressured agendas and little time for discussions, we have decided to undertake this innovative approach so that those of you who are interested and have the time to can watch this video ahead of the meeting. Our goal is to avoid lengthy presentation sessions during the meeting and focus our attention on the discussions with you. On this note, I would like to thank you in advance for taking the time to watch this video, and we look forward to welcoming you virtually to next week's meeting. The agenda for the meeting includes welcoming remarks, report and activities overview followed by discussion, a look at PACT's Work Plan 2022, and a discussion on collective priorities on equitable access. The COVID-19 pandemic put healthcare systems across the EU under enormous strain and has profound implications for access to quality and timely healthcare and services in all EU member states. Unfortunately, the pandemic proved that we were right. Looking retrospectively to the Future of Health Conference of PACT back in 2019, dedicated on the UN 2030 Sustainable Development Agenda in Europe, some 115 delegates representing patient organizations, healthcare professionals, policy institutions and governments, public health NGOs, experts and industry from 22 member states addressed a broad range of issues and challenges and opportunities that are related to progressing EU-level health policy. The conference also provided the occasion to introduce the Health Pact, which contains a shared vision, shared responsibilities, and the actions needed to improve access to health and to advance the Sustainable Development Agenda in Europe. The document reaffirmed the need for stronger EU-level health competency, and while others often perceived as weak, this remains highly relevant, facilitating the sharing of experiences and mutual learning while assuring appropriate coordination and direction can and will be beneficial, the document says. Moreover, existing tools and instruments such as the European semester process and Horizon Europe can be put to better use to ensure a health dimension in other EU-level policies. However, the document suggests, in order to truly achieve a multi-sectoral approach to health, the priorities of other sectors will need to be identified, as the health aspects of these priorities can provide useful entry points for cooperation. I think this message has never been more relevant than nowadays. As a result of COVID, we, like everyone else, had to set our projects in a new reality. Shortly after COVID-19 took over, PACT and the MEP Interest Group on Access to Healthcare released a joint statement, which nailed down the critical immediate challenges for access to healthcare and how they can be addressed fairly, collaboratively, and with the needs of patients and citizens at the forefront. The forward-looking statement complements the announcement by President von der Leyen at the time on a dedicated health program and the publication of the country-specific recommendations of the EU semester process and other policy initiatives in which much focus was placed on building resilience and preparedness. Other advocacy initiatives of PACT include the Becker hearing. Dr. Stanimir Hasrjev was invited to the first public hearing of the Becker Committee for the new year of 2021, held on the 11th of January, which addressed boldly patients' rights and access and sought to hear patients' advocates' recommendations for the forthcoming Becker report. Dr. Hasrjev encouraged that the Beating Cancer Plan is seen as a strategic step to promote excellence and provide guidance for implementation, to eradicate inequalities in access to healthcare, to facilitate timely access to quality health and care, and to provide a springboard to take further immediate actions in other chronic diseases affecting millions of Europeans. Additionally, PACT held a meeting with the head and deputy head of unit at DG Santé to present the Model Access Solutions Initiative, the expected outcomes of the project, and the method of implementation. Only recently, Dr. Stanimir Hasarjev was invited by DG Employ at a meeting in the area of health in Bulgaria to discuss the country-specific recommendations and potential areas for further efforts in improving healthcare and services. In 2020, the MEP interest group was relaunched with new members on board. The remarkable achievements of the previous MEP interest group are a stepping stone for the future efforts of the new one in ensuring equity and access to quality healthcare for all. PACT is delighted that these efforts will not be wasted, but enhanced with renewed impetus and competence that the new members will bring along during this mandate. Their contribution and efforts are even more crucial now amidst a pandemic of unprecedented consequences. The Patient Access Partnership further reaffirmed its commitment to support their initiatives by means of patient-centric expertise, multi-stakeholder engagement, concrete actions in line with their concerns, and technical assistance to facilitate this exchange. On the 26th of June, members of the European Parliament, together with the Patient Access Partnership, officially relaunched the Interest Group on Equitable Access to Healthcare. The 2-hour online event entitled More Health in Europe or More Europe in Health outlined the main objectives of the group and reflected on the renewed strategy of the Patient Access Partnership for the new mandate of the European institutions. The year began with the new year, 2021, then began with a technical meeting to set the scene for the overall strategic direction of the MEP Interest Group on Access in 2021 and beyond. In a statement released following the meeting, the co-chairs affirmed the need to act collectively to reform health systems across the EU and avoid future scenarios when we're forced to prioritize emergency pandemic response over critical long-term care. They welcomed the initiative to use an EU joint procurement mechanism of medical countermeasures for vaccines and medical equipment, and urged the European Commission and Member States to explore the feasibility of applying this to other areas of strategic importance. Encouraged that the accelerated development of safe and effective COVID-19 vaccines is accompanied by robust and timely rollout strategies to ensure that the procured vaccine doses reach the population in different parts of the EU at the same time, and further reiterated that the European Commission also needs to put forward a coordination mechanism to ensure that any surplus doses are not wasted, but distributed swiftly to our neighbors and international partners. Well, given the magnitude of rebuilding societies and economies and the investment therein, it is critical to draw on previous knowledge, data, experience, and leadership to ensure that the resources are used in an optimal, impactful, and meaningful way. With this in mind, the MEP Interest Group, in cooperation with the Patient Access Partnership, held an event in April 2021 to reinforce the added value of transforming policies into implementation strategies in the field of healthcare, to ensure that these underpin concrete actions at the national level. The webinar presented for the first time publicly the findings of the HSPA report on measuring access to healthcare and discussed to what extent such tools play a role in monitoring and evaluating the national recovery and resilience plans. To what extent will the recently published action plan on pillar of social rights be a milestone in delivering on the promise for more equitable access to healthcare? And what is needed to turn a vision of European Health Union that promotes equitable access into practice? I would like to now turn to the flagship project of the Patient Access Partnership called Model Access Solutions. By virtue of PACT's identity of a multi-stakeholder platform, we have always been committed to broad stakeholder representation in everything that we do and advocate for, and the project Model Access Solution is no exception in this sense. It is part of the renewed strategic focus of PACT in moving to solutions mode to identify and share workable solutions to equitable access across Europe so that they receive the attention of broad network of stakeholders, policymakers, and donors. We very much hope that this initiative is in essence a driver and a learning process for all stakeholders involved. The promotional video that I would like to show you will tell you more about this project in a brief manner. Seeing this video has hopefully brought clarity on the project and its expected impact. Well, set in the broader context, PACT wants to move beyond ensuring that the patient access is on the political agenda only to also look at selected evidence-based workable solutions. What is a model solution? These are person-centered, correspond to the 5 A's, have demonstrable impact, and have the potential to be replicated and scaled in Europe. What we see as value in this project is that this is a multi-stakeholder learning process aimed at transforming the healthcare systems across the EU, and that it aims to address the knowledge practice gap by engaging the patient who is the recipient of care and has the expertise on issues of access to healthcare. The objectives of the project are to identify the best practice initiatives aimed at improving access to healthcare for patients and showcase them in a web-based repository so that we can achieve optimal visibility of these initiatives. We would like to hold one dedicated meeting per cycle to discuss how these best practice initiatives can be replicated by stakeholders in other countries and scaled on local, regional, or national level in the country of origin or another member state, And we also will work closely with the MEP Interest Group on Equitable Access to convey powerful and clear messages about the role of the European Union in encouraging the systematic uptake of the existing best practice examples. So many people have been involved in the different preparation stages of this project, from PACT Secretariat and Steering Committee to partners who contributed with insights during the first workshop that we held back in November, and appointing experts to be considered for the advisory board to the initiative. The members of this multi-stakeholder advisory board that you see here are all distinguished and knowledgeable experts, patient representatives, entrepreneurs, healthcare providers, public health experts, and academics. They have been both a driving force in fine-tuning the project outline, but also an inspiration to PACT for the time, expertise, attention to the detail, and recommendations that they provided all along. We thank you, and we thank them for being with us in this endeavor for so long now. And we strongly rely on you, our partners, to continue this journey with us by spreading the word among your networks and affiliates so that we can discover the best practice examples that these pearls of excellence in access to healthcare that are in the spotlight of this initiative. The project consists of 4 phases, which include a workshop that we held back in November, an advisory board formation, an open call that was just launched yesterday, a selection process by PACT Secretariat, an assessment by the advisory board, a repository that includes the selected model access solutions of PACT, a workshop to discuss their replicability, and an awareness follow-up campaign so that we can promote further the selected proposals. The model access solutions has very reliable criteria of assessment. This has been proofread and fine-tuned with the advisory board for the project. It includes 3 main criteria: inclusion, outcome, and advancement criteria. The inclusion criteria will assess whether the proposal meets the eligibility criteria. The outcome criteria will assess the extent to which the proposal improves equity of access, and the advancement criteria will assess the potential of the proposal for further scale-up. Well, we'll probably agree that progress in ensuring better access to healthcare was sadly undermined by the pandemic and chaos. And this is why, in the first cycle of the Model Access Solutions, applicants will be invited to submit initiatives to provide equity of access to care for patients with chronic conditions during the COVID-19 pandemic. Who can apply? Well, basically any stakeholder directly or indirectly involved in the field of healthcare whose initiatives aims to provide equity of access to health and related care for patients. These can be healthcare service delivery projects, information, awareness raising campaigns, interventions, screening, research projects, public policies, tools, instruments, guidelines, e-health or m-health projects, trainings, or other, whatever you might think of. This is one of the campaign materials that was broadly distributed in our channel's website and Twitter, and of course it's supplemented by a number of other promotional materials. These include a dedicated web page, video, social media campaign, email notifications, additional dissemination pack and tools to promote this further, and most importantly, partnerships. We really need partnerships to reach wider audience and to reach this best practice example that we're looking forward. And in this regard, your role is absolutely crucial. At this point, I would like to turn our attention to the next point on our agenda, which is Work Plan 2022. It is important to say that the work plan objectives that we've identified and would like to discuss with you during the meeting are all set within the context of a renewed focused approach for PACT to maximize impact in the next 5 years. More concretely, it is positioned within the interest group on access to healthcare priorities so that the interest group becomes a real campaign engine and for equitable access, and involves MEPs from other committees. We also would like to reposition PACT within the new commission so that we become a multi-stakeholder partner and a particular source of expertise on access in CE. We would like to also make sure that we include an equity of access angle of the presidency by early interaction with each EU Council presidency and proactively defining PACT's role. A first step in this regard was the presence of the Portuguese presidency health attaché during the MEP interest group meeting back in April. The objectives 2022 are draft objectives that, of course, will be additionally modified depending on the discussions that we're holding next Wednesday. More broadly so, our aim is to promote access high on the agenda through regular meetings and topical statements of the MEP interest group on equitable access to healthcare. We also would like to maintain close collaboration on the issue of equitable access with health initiatives and relevant EU institutions, including the Commission and EU Council presidencies. We also would like to raise awareness on sustainable access-related initiatives that carry significant potential for replication and scaling through the Model Access Solutions initiatives and Digital Pact, and we would like to strengthen PACT's governance and financial viability, basing ourselves on lessons learned from the pandemic in the long term. We would like to prioritize and consolidate the relation with PACT partners on access-related topics of mutual interest and significance, and next week's meeting is a major step in this regard. Before I finish off, I would like to touch upon an idea that we are very eager to develop in future. To ensure optimal visibility of our work, PACT will seek to establish a digital platform, provisionally entitled Digital Pact. Digital Pact will serve as the portal to the Model Access Solutions repository and will also be a platform in the best interest of patients and other stakeholders by being the space for digital and hybrid events at PACT, the MEP interest group and the PACT partners. We'd like to have access-focused policy discussions there and initiatives. We're going to provide networking opportunities for all users and robust and valuable information on access-related issues. We believe that such a platform will foster inclusiveness beyond the Brussels policy space. It will be a shared space for the PACT partners and their members from across the EU member states to raise topics for discussion and share key documents and developments in the sphere of equal access beyond and after COVID-19. It will be an engagement and outreach instrument, but also a place where our MEP events will be streamed online, giving broader access for those who cannot be in Brussels physically to attend these meetings. In this respect, this solution, we believe, will enhance the accessibility and the added value and impact of PACT's initiatives at national, regional level, and will also ensure that the model access solutions are promoted to a pan-EU audience of health-related stakeholders. Well, in practical terms, by creating a digital platform with a repository for model access solutions, PACT will share the best practices in the field of equitable access, as well as tools and policies needed to facilitate their replication and scaling. With robust patient-focused assessment criteria and a multi-stakeholder advisory board, will provide a stakeholder-endorsed platform for rigorous and open reflection and dialogue. In the second part of next week's meeting, we'll dedicate more than half an hour for a strategic discussion on collective priorities. The discussion is an opportunity to identify common priorities between PACT and its partners and to source the key issues of access to healthcare that our stakeholders deem most important to tackle. A conversation that we believe will provide insights useful for your work as well. To ensure an informative discussion, upon registration, you've been asked to answer a question that will be a stepping stone for the meeting discussions. And we strongly encourage you to be active participants in these sessions, as the outcomes will be taken into consideration when planning our activities ahead, in line with and in cooperation with you, our partners. At this place, I would like to finish off my presentation and thank you very much for your attention. We'll see you on Wednesday.